Can you hear me, Lori?
Okay, now I can hear you. Hello, Ryan. Welcome to Telehealth.
Thank you. Good morning, Lori. Gosh, that was so easy how I just was able to click that link on my email and everything was set up. So, do you want to tell me a little bit about how a typical telehealth visit works?
Sure. So, as you saw, when I admit you from the virtual waiting room, I can control who's in the meeting. And so we don't have to have any worries about others joining us by accident. And so this is one of the ways that it stays secure. So after I would greet you as a patient, I would verify who you are by your date of birth. And I also have to ask what state you live in because in Michigan, physical therapists can only treat residents of Michigan.
Okay. So, what's next after we've kind of greeted each other and verified some information? How do we proceed with that visit?
Sure. So a visit virtually is very much like a clinic visit. So the first thing we start with is discussing the problem that the patient has. And then we go into taking a history. Often we have records from the physician so that I can fill in the pieces there, but then we can talk more specific about the history of the problem. Then I can actually do an exam. And often I have to have the person get up and move around a little bit. But after we do the exam, then together we discuss the treatment findings and come up with a treatment plan, including exercises and other instructions.
Well, that's really interesting. So, what you're saying is that most of what you do in the clinic on a day to day basis can be done over the internet.
Absolutely. Some of the statistics are that with a telehealth visit, we can accomplish most of what we need to do, similar to the clinic. Maybe even like 70% or more of what needs to be accomplished can be accomplished with a telehealth visit.
Well, that's pretty amazing. I imagine there are some things that people might want to know in terms of preparing for the visit, tips and things that they should be aware of. What kind of things that should the
Yep.
patients be aware of?
So that's a great question. So for one thing that's really helpful, I've found as I've done these visits is if the patient can wear snug fitting clothing, because as I ask them to move around, it helps me see more clearly how their body is moving. Also, if the patient can be in a quiet, well-lit room, that also helps me see better what I need to observe. And then what I've found too is with sound, wired or wireless earbuds can really help. They're not necessary, but they do seem to help with the quality of the sound. And if they're wireless, then of course, as the person's moving around, that can really help. What I have found is kind of like at the beginning of our visit, it's nice to have a backup audio, like a phone nearby, because sometimes people have to adjust sound settings on their computers. And so if they think I can hear them and I can't, it's nice to have a way that I can then text them or call them and say, okay, I think we need to adjust some settings on the computer. So yeah, that can be really helpful.
I imagine, especially at the first visit, there's some kinks to be worked out with that, and then once you learn the system, it's a little bit easier each time.
Right. And that's what I have found with all the people I've treated. They have been, they're not really sure what to expect, but then once we get into it, they're like, oh, this is great. And we can accomplish a lot of what we need to do. And I know that we think, well, maybe there's some of us out there that aren't that tech savvy and can't do this, but it's so easy that I have a number of patients that say they're not that tech savvy and they have really taken to this.
Well, that's really great news for people that might fall into the high risk category with the COVID-19 virus going on, or might be feeling uncomfortable coming into the clinic, being out in public. So it's just such a great option.